Look at this. 69, almost 56. What are you doing to your neck?
I do a Sculptra and a TCA peel on my face and my neck. I've been doing this since I'm 40. We're going to do the same thing for you. Get this nice, firm, and tight with this combo. Sculptra, TCA chemical peel.
And you really think it'll make a
It
difference
will,
in
it'll
this?
tighten. Yep.
And doesn't it just keep getting better?
Well, that's what's so wonderful about Sculptra. It actually stimulates collagen elastin for an entire year.
Yeah, her neck, I think, looks better than mine.
No.
And she's 20 years, how old?
I'm 69. Not that bad.
I'm looking forward to it. Guys, stay tuned.
Yeah. Hi, I'm Lauri Kane with the Plastic Surgery Office of Dr. Dean Kane, and I'm here with Jen, who's been a patient of ours for well over 20 years. But we're here today to talk about TCA chemical peels and even Sculptra for you.
Yes. So I want my neck to be like your neck.
Yep. So what I've been doing for my neck and face has been a combination of Sculptra and TCA chemical peels.
Okay.
And that combo on the same day, actually, so that you only have one recovery.
Okay.
Yeah.
So I definitely want to try this. What is my preparation for it? What do I have to do?
So you've been very good. You've been coming to us and been on the program with Dr. Obaji's ZO system, using your tretinoin and your pigment control. So we require a minimum of 6 weeks of preparation before we'd ever do a chemical peel. But because you're actually well prepared, we could get you going with the peel pretty quickly.
Okay, awesome.
Yeah.
And when I come in, what do I expect for, I've had the TCA peel, so I know what that is, but I'm sure others would like to hear about it. But the Sculptra, like
Okay.
what am I, tell me what I'm expecting.
So-
I'm nervous.
I understand. It's interesting that she's nervous over Sculptra and not
Right.
over a peel, because most people are more worried about the peel than they are the Sculptra. But Sculptra is a collagen stimulator. They are injections, and what we will be doing right now, we're only going to do your neck. We're going to do a TCA chemical peel on your face, but for your neck, we're going to do the combo of TCA and Sculptra on your neck. So for the Sculptra, we have you come in and put a numbing ointment on your neck, and it really amazingly, it's a very specialized numbing ointment we use. It truly does numb.
Nice.
And so when the injections are done, you really don't feel it very much at all. So you don't have to worry about the needle problem, the needle issue for that.
How about afterwards? Is it painful? Is it bruising? Do I have to
So
wear, can I put makeup on?
It's during the process of having a peel done and having the Sculptra done where you have your most uncomfortable situation. The TCA, I'm not going to soften the blow. It is a 10 out of 10, but we have beans to help patients get through that. We use Pronox, which is a laughing gas. And it really makes you feel like you've had 2 martinis, and you could drive yourself to the office and back. For those patients who really feel like they need more than that, we do offer sedation type medication where someone would bring you, we have you take it before you get to the office. You're really sleepy, and then you don't even remember having the peel done the next day. Like, people don't even remember it was done.
When they wake up, they'll remember.
No, really, they don't
No?
even know. It's
Wow.
amazing. They don't remember that they had the peel.
Okay.
It really, that combo
Wow.
is pretty great.
Okay.
So yeah, the peel takes about 15-20 minutes. Dr. Kane is looking for a white, even frosting on the face, and then once he gets to the depth that he wants to see, that's when he stops. And then it self-neutralizes itself. So that's the process. It's very quick. He goes around the face so that when one side is really getting uncomfortable, he goes to the other side, and we go really slow. So that way patients can tolerate it. We use a fan. Believe it or not, a fan really works well. And so we get everyone through this process. We really do.
Okay.
So it's really not a bad
And
process.
what about like the aftercare? Like the day that I go home, am I going to be swollen? Am I going to be feeling any pain?
So interestingly enough, with the TCA chemical peel, the next day you actually look good. The face looks tight, and you could go to work, so it's really not a problem. You're a little swollen, but you don't really see a lot of change yet. You're not the recovery of a TCA chemical peel and the Sculptra. There's no pain whatsoever. There's zero pain, so you don't have to worry about the aftermath. It is going to be a 7-day recovery. With the TCA chemical peel, each day that goes by, the skin is kind of tightening, deadening, and if you have sun damage, the pigment, the unwanted brown, just comes to the surface. So the darker you get, the better, because on day 4, 5, and 6 is when the skin gently peels. Again, no pain involved with this. You love when you begin to peel. And as the peeling comes off, this brown dead layer of skin is coming off, and you're left with brand gorgeous skin underneath. So day 7, you're usually completely peeled.
So I'd imagine it tightens up under the eyes.
Oh, it's perfect for crepey skin under the eyes.
Do you put it on top of them?
He does. He does the upper, lower eyelids, and the whole face.
Oh, wow.
Yeah, it's really ideal.
And the neck can be done?
The neck can be done at the same time as your Sculptra. With the Sculptra, there is the Dr. Kane has the 6-6-14 rule. You really have to massage Sculptra. That is key. There's a very low, tiny risk of a nodule. So the way to really bring that risk down is that's why he has his 6-6-14 rule. You massage 6 minutes a day for 6 times a day for 14 days.
Wow.
So you can do it with the peel, because you could take your Aquaphor, which we're going to use for your peel, and you just apply it. And as you're applying it, you're just massaging it at the same time. So the peel requires Aquaphor as well as just cold water soaks. That's all, and a gentle cleanser.
Okay.
This, we give you a massage cream to massage, and really it's painless. There's nothing there.
All right.
Yeah. So that's the process and the recovery, and then
good.
7 days later you look amazing.
Okay.
Yeah.
I'm ready to do it.
Yeah. And what's wonderful about the Sculptra and the peel is the peel, you go back on your retin-A, and your skin just continuously looks better and better.
Like, when can I go back on the retin-A?
Usually about day 10.
Right at day 10.
Yeah, day 10 to 14, depending upon whether you're pink or red or not. But we want you right back onto your retin-A, and also the Zeo system for the pigment control, to control any possibility of pigmentation. And then the Sculptra, again, what happens is over a year's time, you actually progressively get firmer and tighter and just beautiful.
Wow.
So
I'll age backwards.
yes, you'll look younger at the end of a year than you will when you started.
Sounds like a good win-win to me.
Yeah, and I know we're going to be showing you the whole process.
Yes.
So stay tuned to watch the whole system, the whole process on Jen.
Yes, I'm going to be filming before, during, and my recovery.
Yep, it's a perfect thing to keep. So you'll really understand the whole process.
Yeah.
All right, I hope to see you all.